nice presentation. The next speaker دكتور محمد فوزي. وطبعا أنا دكتور محمد فوزي يعني أعرفه بالتليفون. تشرفت طبعا بمعرفة حضرتك، وطبعا يعني كل التعاون والدعم يعني أول ما كلمته. إن شاء الله البرزنتيشن رول اوف HIFU in primary and metastatic liver disease. اتفضل دكتور محمد.
ميرسي يا فندم. ميرسي يا دكتور منال. It's always a pleasure يا فندم. ميرسي جدا. يا رب تفتح. تاني. عايز ماوس. Mr. Chairman, attendees, thank you for giving me this privilege. It's always a pleasure giving a lecture in our dear society, Radiology Society. It's different than any other society. We're going to talk about HIFU in non-invasive ablative therapy for primary and secondary liver tumors. Our main theme is that diseases that harm require therapies that harm less. Some people go far by considering HIFU to be the surgery of the future. HIFU is an abbreviation for high intensity focused ultrasound. Since 1942, Lin et al. Firstly brought forward the conception of HIFU. Early in the 50s, William Free and Frank Free envisioned in vivo treatment with high intensity focused ultrasound as a novel, non-invasive technique that uses extracorporeal source of focused ultrasound energy to induce coagulative necrosis in targeted tissues without damaging overlying and surrounding vital structures. However, not until the 90s was this dream turned into reality by a team of researchers from China led by Professor Wang. Hepatocellular carcinoma is the most common primary liver cancer. It is now the third leading cause of cancer death. Hepatitis and excessive alcohol is the leading cause of HCC. A liver metastasis is a cancerous tumor that has spread to the liver from a cancer that has started in another place. 20–30% of patients with colorectal cancer will have liver deposits at time of diagnosis, and overall of 50% will develop liver deposits during their course of treatment. Other primary cancers that are most likely to spread to the liver are from the breast, esophagus, stomach, pancreas, lung, rectum. Cholangiocarcinoma is a cancer that arises from the cells within the bile ducts, both inside and outside the liver. When the tumors arise within the liver, the tumor can be small or large. The term cholangiocarcinoma or bile duct cancer are both used. Cholangiocarcinoma is a type of tumor that is very difficult to treat. Liver transplantation is considered the most definitive treatment available for HCC because it removes both the tumor and the underlying diseased liver, if the tumor size is within the accepted guidelines. Liver resection is still the main treatment option for HCC and liver deposits and cholangiocarcinoma whenever feasible. With advances in technology, local ablation therapies have emerged as an effective treatment option. These include cryo, interstitial laser therapy, microwave, radiofrequency, and HIFU. HIFU is based on the unique characteristics of ultrasound beams, which can be focused at a distance from the transducer. The accumulation of the energy at the focal region induces tissue necrosis of the target lesion without causing damage to the surrounding structures. The ability to induce immediate cell death at a distance from the ultrasound source without need of surgery or insertion of ablation instruments makes HIFU an attractive treatment option. The location and extent of treatment can be monitored accurately with real-time ultrasound. In grayscale images, a hyperechoic region occurs within the exposed volume after focused ultrasound, which is called sonication, which is considered as an indicator of tissue necrosis. Like in RFA or microwave, the grayscale changes, the ablation. HIFU, mechanism of HIFU ablation occurs to thermal effect and mechanical effect. Advantages of HIFU: it's completely non-invasive, precise ablation, one-time treatment in most of the cases, real-time ultrasound guidance, it helps in activation of the immune system, short hospital stay, and low cost. Or actually, it's now on outpatient basis. There's no need even for hospital stay. And definitely no skin incision. That's why it's completely non-invasive. The ultrasound beam propagates. How does HIFU works? The ultrasound beam propagates through the tissues, focuses in a single point. It's a very small point. And when we ablate a focal point, and then we ablate a point after a point to form a line, and then we ablate a line after a line to form a plane, and then when you gather these planes together, they make a volume. And this is how you ablate the whole volume of tumor tissue. It gives, of course, access to do large volumes. There is no restriction to volume if visible and accessible. It is very safe. It's very safe to do HIFU in presence of ascites, and actually this is the only ablation technique that works in patients with ascites. It's safe to do subcapsular lesions and to do tumors adjacent to vessels. And it's a very thin margin, very tiny margin between the tumor tissue and the non-neoplastic tissue. How do we assess the response? We assess the response, as you can see here. Before HIFU, this is a lesion in the liver, and this is the grayscale changes that happens during HIFU, and you see it live during the procedure. Here are a few examples of cases that we did. This is a 55-year-old male with single liver deposit from colorectal cancer, colon cancer, primary tumor resected, took chemotherapy, and as you can clearly appreciate, there is a single deposit here in the left lobe. And the time of sonication, the time of ablation was 1,290 seconds, and the room time is 98 hours. HIFU is a bit long procedure in comparison to other ablation techniques, but its advantage that's completely non-invasive. As you can see here in the HIFU images, you can clearly appreciate the grayscale changes during the procedure, and of course our patients lie prone, and you can see here the grayscale changes that are very clear. And these are the images post treatment. And this patient, we did this procedure 2.5 years ago, and the patient, there's no recurrence. Second case, 79-year-old male patient with single liver deposit, also from cancer colon. Primary tumor was resected. He took chemotherapy with still resistance to this deposit. This is maybe case number 3 that we did. We did it in 2017, and the sonication time was 1,600 seconds. Room time 125 minutes. And as you can clearly here see the images before treatment, and then it's a bit large and in segment 6. And here you can appreciate the grayscale changes that occurred during the sonication. And here's the post-treatment. It's like a geographic, it's like a resection actually. The whole region is resected, and this guy is a Sudanese guy, and he's doing very well till now. Our third case is a 34-year-old female with single liver deposit from breast cancer. Primary tumor was removed, and she took chemotherapy, and her sonication time is 1,120 seconds. As you can clearly see, this is a single deposit at the right portal hilum. It's a bit, how do you say it? Maybe quite a bit not difficult, but maybe tricky doing percutaneous ablation like RFA or microwave. It can do well with microwave, but we did it completely with HIFU. And as you can see here, the grayscale changes. I just want to show you quickly this video in order for you to. This is a very short video that will show you. I just want to show you, this is our case. I just want to show you what happens during the sonication. As you can see here, this is during a water media, cool water, and this is the ablation taking place here. And these are the grayscale changes. So you're actually working live. You're watching each part you're ablating. As long as you can see it. Okay, and this is the post HIFU images. Very well ablated. This is 61-year-old male with pathological proven cholangiocarcinoma. He had no biliary obstruction, normal labs. This is the right lobe here, the cholangiocarcinoma here. And you can see the grayscale changes also that was present during the treatment. And this is its, in cholangiocarcinoma, actually we are here in Cairo, we are starting implementing HIFU in cholangiocarcinoma because we believe that cholangiocarcinoma is one of the diseases that do not have much options to treat. So we work as our plan is to try to be the primary curing or combined with chemotherapy. In this case, we worked it to cause tumor burden, decrease tumor burden in order to be able to, for the chemotherapeutic agent to be more effective. This is a 49-year-old female also with cholangiocarcinoma. Here, these are the grayscale changes that are seen. And also this is the post-treatment ablation, and she did very well actually. My last case is a very nice case, a 24-year-old man who has a cholangiocarcinoma proven by biopsy, took all sessions of chemo and did not respond. And he came to us, it's a hilar cholangiocarcinoma. So we had to introduce first a metallic stent before the procedure because it's, the lesion is in the hilum, here as you can all see. So, and here we started to do the HIFU treatment. Why do we have to put a metallic stent? Because we do not want to cause biliary injury. And we can put metallic covered stent if you're planning to remove it, or just a metallic stent. We just put a metallic uncovered stent. And this is the response post-treatment. And this is the MRI post-treatment. We did this guy 2.5 years ago, maybe two years and a quarter. And he stayed 2 years tumor-free. And then maybe 1 month ago, he developed another one in the right lobe, but he stayed 2 months completely tumor-free. And here's his MRI images post. And this is also a patient with HCC, hilar. This is really what's good about HIFU is that you can reach the hilum very safely. And these are the grayscale changes also. And this is 12 months post, it's almost disappeared. I just want to show this image. It shows you that you can very easily ablate the tumor during the presence of ascites and during the presence of hepatic veins. High intensity focused ultrasound in hepatobiliary pancreatic digestive system. It can be used, we are implementing using HIFU as a modality for downstaging of HCC before liver transplantation, bridging as one of the bridging therapies before liver transplantation. Extracorporeal ultrasound guided high intensity focused ultrasound is a non-invasive, safe, effective and feasible technique for tumor ablation at depth within the body selectively without harming overlying and adjacent structures. HIFU ablation can achieve substantial tumor response with only minimum and transient side effects. HIFU provides an attractive non-invasive therapeutic option in the management of HCC and liver deposits, as well as expected emerging role in cholangiocarcinoma. HIFU treatment can significantly reduce the dropout rate of patients from the transplant waiting list, as it can be used for downsizing large tumors as a bridging process for liver transplantation. This is just an image to show you. This is our MRI HIFU unit here in our Liver Institute in Cairo. This is the HIFU unit, and it's just mobile. We move it on the MRI machine, and then you remove it after you finish. Thank you.
Thank you very much, Professor Dr. Mohamed Fawzi, for your nice presentation. The next speech will be on correlation